Hello everyone, good day. This is Hugo Lin from Kaohsiung Municipal Tatung Hospital affiliated with the Kaohsiung Medical University, Taiwan. Today I want to share the topic of my talk is the new hope for a kidney disease treatment, mitochondria. In the first slide I show here is according to the United States Renal Data System Annual Report, we could find that from 2000 to 2020, the incidence of end-stage renal disease, which indicates people or patients may need to receive a renal replacement therapy. The incidence increases a lot, so here we can see there are more and more kidney disease patients and there will be the need for the new treatment development to overcome the burden of the kidney disease. So for a kidney disease we should know what the mechanism underlying the kidney injury and transform into chronic kidney disease development. First, according to AKI, the acute kidney injury we could find which indicate when patient received a kidney injury it may recover within 48 hours. However, some of kidney could not recover totally and it may progress from AKI, transition into acute kidney disease, AKD, and then progress to CKD, the chronic kidney disease, which indicates patient may suffer long-term kidney disease malfunction for more than 90 days. So from AKI to AKD and to CKD, it may need to dissect what's the underlying mechanism that caused the kidney disease could not recover automatically. From the epidemiology of AKI, the prevalence of AKI among hospitalized patients is 13 to 18% in developed countries and has increased 11% per year, and the mortality rate of patient diagnosed with AKI ranges from 35% to 45% within 90 days of discharge. The incidence of AKI associated with CKD was 7.8 events per 100 patient years, and with end-stage renal disease, which we set in ESRD, was 4.9 events per 100 patient years. However, there is no effective treatment for AKI. There are three main categories for AKI. The first one is pre-renal AKI, which indicate the injury of the kidney is before kidney itself. It may be caused by tubular from acute upper gastrointestinal bleeding or by hemodynamically unstable. The other ones are post-renal AKI, which may indicate there are some obstructions like ureteral stone, renal cancer, or something like BPH. Benign prostate hyperplasia, obstructing your urine outflow from kidney. This may also cause postrenal AKI. However, the majority of AKI is intrinsic renal AKI, which could be further divided into four categories, which according to the renal histology: tubular damage, glomerular damage, interstitial damage, and vascular damage. The tubular damage is the most interested and the majority one of intrinsic renal AKI. They could also separate into ischemia, reperfusion injury, and nephrotoxicity. Today my talk with focus on ischemia renal tubular AKI. The ischemia reperfusion injury of kidney, which indicate in the first, there will be decreased blood supply for the kidney, then the kidney blood supply will come back. However, with the reperfusion of the kidney, although the blood flow perfuse kidney, that will activate several signal pathway which include inflammation that come in, including chemokine, cytokines, for example TNF-alpha IL-6, and also the complement system to be activated. It includes CA, C4A and C5A, and oxidative stress also be increased. Excessive renal oxygen species, reactive oxygen species, and free radical production may be harmful to the kidney, and the nitrate and nitrate oxide, which will also activate NOS and INOS in the renin-angiotensin system, which is known for its regulating the hypertension blood pressure of the human and animal body, will also be activated. We could see in the kidney it includes more than 1 million glomerulus, and the vast physiological unit for kidney and glomerulus, then it compose with the renal vessels and then transform to glomerulus, and then we also be the Bombs capsule with the loop of Henle and renal proximal tubule, distal tubule and collecting duct, and the renal proximal tubule. Its majority physiological function is try to reserve the 90% or 92% of electrolyte or nutrients of the urine, so it needs tons of mitochondria. Mitochondria, also known as the cell powerhouse, and it not only supplies energy for the cell, It also composed lots of signal transduction. From our previous research we could find activated AKT1, which also known as protein kinase B, is not fixed in the cytoplasm. After activation it may transform of traffic from cytoplasm into mitochondria or cell nucleus, and it also conduct intramitochondrial. And we found mitochondria AKT1 against the apoptosis through lots of retro-review and our previous study. Activation on mitochondria AKT1 suppress oxidative stress and apoptosis in cardiomyocytes, and activation of mitochondria AKT1 enhance ATP production in cardiac muscle cells. Mitochondria AKT1 signaling play a protective role against apoptosis and necrosis during ischemia reperfusion stress in cardiac muscle cells. However, there's no proof research to investigate the role of mitochondria AKT1 inside a renal tubule, its mechanics role for the ischemic reperfusion injury. So we try to inhibit the tubule mitochondria AKT1 in an ischemic reperfusion injury in AKI. We designed and created a transgenic mice study. And we could find with the decreased renal function observed in tamoxifen-induced the TAM treated of the knockdown mitochondria renal tubular AKT1 mice after the ischemic diffusion. We could see here after 45 days in tamoxifen-induced renal injury AKI mice their creatinine is significantly higher compared to corn oil injecting mice, which indicates with the knockdown renal tubular mitochondrial AKT1. Mimicking the knockdown mitochondria AKT1 signaling inside a renal tubule after AKI, mice suffered higher renal injury. And we could see through the histology proof there is aggravated renal injuries in the KMD-AKT mice compared to the corn oil mice. In tamoxifen mice there is still higher significant Jablonski score, which indicates the severe renal tubular injuries in the KMD-AKT mice after tamoxifen injected mice. So the summary of this series study, we could find inhibition of tubule mitochondria AKT1 aggravates kidney failures induced by ischemia reperfusion. And we want to further to investigate whether if we aggravate the mitochondria AKT1 signal inside the renal tubule will it protective the kidney functions from injuries. We try to breed and create another novel transgenic mice which we called KMD-AKT mice, mimicking the constitutive active mitochondria AKT1 inside the renal tubule. After tamoxifen injection, after ischemia reperfusion, the mice have a significant lower renal function, and compared to the histological findings, with the tamoxifen injection, the KMD-AKT mice we could find with the enhancement of the tubular mitochondria AKT1, it could ameliorated the renal injury in a KMD-AKT mice compared to the corn oil injection. Also not only improve or protect the renal histology from injury, according to the survival analysis, we could find when we try to increase the mitochondria AKT1 inside renal tubule, it could also improve the survival rate of KMD-AKT mice after tamoxifen injected compared to a corn oil. My summary of the series study is that we could find augmentation of the AKT1 in renal tubule could reverse kidney injury-induced ischemia reperfusion. So our study make a conclusion summary that we could find, through the KMD-KT or KMD-AKT mice, after kidney ischemia reperfusion, through histology and functional analysis, it could show with the decrease the mitochondria kidney, it will increase the uncoupled respiration with increased proton leaked, and decrease ATP production, and that will cause tubular cell apoptosis to renal dysfunction. In the future, my lab will keep investigating the role for renal protection. And I'd really thank my mentor, Dr. Ping Wang from City of Hope Medical Center. And also, I'm thankful to my lab members and my colleagues. My lab will keep trying to do the translational research. And we will focus on kidney injuries, and we open any possibility to make cooperation with people from all over the world. Thank you for your time and attention.